Ready?
Mhm.
Okay. Knock, knock. Hi, Mr. Danik.
Yep.
Hi, my name is Jessica Van Horn. I'll be the student nurse that's taking care of you today. I'm going to be taking your medical history, and then we're going to be doing a quick physical exam.
All right.
Before we begin, do you mind stating your first name, last name, and date of birth?
Andrew Danik, January 21st, 1994.
Okay, and do you prefer to go by Andrew?
You can call me Drew.
Okay, well, it's nice to meet you, Drew. So what brings you in today?
Just a routine checkup.
Okay, so just a little breakdown of how things will go today. I'm going to start by asking you a bunch of questions about your past medical history, just to get a better idea of what's happened in the past and get a better idea of what's going on today. And then I'm going to ask you system by system questions. We'll go through head to toe. And then I'm going to get into the physical exam, and we'll go from there. Does that sound good from you?
Sounds good.
Okay. So the first thing I'm going to start with is those questions. So do you have any allergies?
No.
No allergies, none to food, medicine,
Nope.
Environment?
Only pollen.
Only pollen. Okay. All right. And are you taking any medications currently?
No.
No over-the-counter medications?
Nope.
No herbal remedies?
Nope.
Okay.
Just a daily vitamin.
Just a multivitamin. Okay. All right. And do you have any past medical history I should put in your chart? Any hypertension, any diabetes, cancer?
I got my appendix taken out
Okay.
in 2002, and then I had a couple concussions, but no, I don't have any of those issues.
Okay, so no diabetes,
Nope.
nothing like that. How did those concussions happen?
I played hockey in college.
Okay. All right. And your appendix was removed in 2002?
Yep.
I'm assuming it was infected or
It burst.
It burst. Okay. All right. And no other medical history?
Nope.
Okay, great. How about any history of anxiety or depression?
No.
Nothing like that? No other mental illnesses? Nothing
Nope.
like that? Okay. Good. All right. How about your family history? And let's focus mainly on your parents, any siblings you may have, and your grandparents.
Okay. My dad has high blood pressure.
Okay.
And my sister has anxiety and depression.
Okay. How about any other history? Diabetes in your family, cancer, high cholesterol, anything like that? Okay, so just the high blood pressure in your father,
Mm-hmm.
and then your sister has anxiety and depression.
Yep.
How's your mom?
She's pretty good.
She's good. She's generally healthy.
Generally healthy.
And do you have any other siblings?
Nope.
No other siblings. Okay. Okay. Now, Drew, do you smoke tobacco products at all?
1 cigar a year.
1 cigar a year for celebratory purposes?
Usually.
Okay. And how about any alcohol?
Yes.
Yes.
Like 3 to 4 drinks a week.
And what is it? Mostly beer, wine?
Just beer.
Just beer. So 2 to 3 a week. Okay. And tell me, what's your diet look like generally?
I eat pretty healthy. I try to stick to like meats and vegetables.
Okay, meats and vegetables.
I do like pasta.
You like pasta. Great. I do too. Okay. And tell me, what do you do for exercise, or how often do you exercise?
Well, since COVID, less. But I used to play hockey a lot and go to the gym. Now I typically just run and do indoor cycling.
Okay. How often would you say you do those activities per week?
4 to 5 days a week.
4 to 5 days a week. Okay. And what do you do for work?
I'm an engineer.
You're an engineer. Very cool.
A lot of desk work.
A lot of desk work. Is it ever stressful?
Yes.
Very
yes,
stressful.
very.
Okay. And how do you cope with the stress?
I like to exercise.
Exercise. Okay. All right. And you'd say that you do have some stress, but you're able to cope with it pretty well.
Yep.
Okay. All right. And where do you live?
I live in Crownsville.
Okay. Do you live with anyone?
Just my girlfriend.
Okay.
And the dog.
All right. Now, Drew, have you ever been exposed to any chemicals or pollutants at work or at home?
Nope.
Okay. And you feel generally safe at work and home?
Yep.
Okay. Okay. All right. So we've gotten to the portion of this exam where I'm going to ask you a couple questions about each of your body systems. We're going to go from head to toe.
Okay.
So the first thing I'm going to ask is, in general, have you had any unusual weight changes?
Nope.
Okay. How about any fever?
No.
Okay. Or fatigue or tiredness?
Nope.
Okay. Very good. How about any hair loss?
Nope.
No hair loss.
I hope not. I'm too young for that.
Okay, good. How about any change in any moles?
Nope.
Okay. What about any new rashes that have shown up?
Mm-mm.
No rashes. Okay, very good. How about, so let's focus kind of on your head and those body systems. How about any headaches?
Nope.
No headaches.
No headaches.
Okay. How about any changes in vision?
Nope. Still colorblind.
You are colorblind. Okay. Okay, but no changes in vision as far as
No
okay.
changes.
Okay. How about any hearing loss?
Nope.
No hearing loss. Okay, great. All right, so let's move down to your neck. Have you had any neck pain recently?
Nope.
All right, no neck pain. How about any swollen lymph nodes or glands along your neck? Nothing like
Nope.
that. No swollen. Okay, very good. How about any trouble swallowing?
Mm-mm.
No. Okay. Awesome. All right, so let's move down to kind of your heart and vascular system. So have you had any chest pain recently?
No.
No chest pain. How about any heart palpitations, or you feel like your heart's beating really fast? Okay.
Nope.
No heart palpitations.
I think my heart is beating though.
Good. I would really hope so. Any swelling in your feet or ankles?
No.
Okay, great. All right, so let's move on. How about shortness of breath?
Nope.
Any cough?
Mm-mm.
Any wheezing?
Nope.
None of that. Okay, great. How about any change in appetite?
Mm-mm. Still eat a lot.
Okay. Change in bowel movements?
Mm-mm.
Or any stomach pain?
Nope.
Good. Okay. How about any joint pain?
No.
Okay. Muscle pain or weakness?
Mm-mm.
Nothing. Or bone pain?
Nope.
Okay. Great. Almost done, I promise, with the questions.
No worries.
I know it's a lot, so thanks for sticking with me. As far as neurological symptoms go, have you had any unusual like weakness?
Mm-mm.
No weakness. Any seizures?
No.
Okay. How about any loss of coordination?
Nope.
Okay. And last but not least, have you had any pain while urinating?
Mm-mm.
Okay. How about any urinary frequency?
Nope.
Pee a lot. Okay. And urgency, like you have to go now.
Nope.
None of that. Okay. Okay, great. So I've gotten through all of those questions. We're going to kind of head into the physical exam part now. I'm going to start with your vitals, but before we do that, I have to ask you a couple silly questions, but it's just for us to get a baseline. I ask all my patients this.
Okay.
Do you know what your name is?
Yes.
Can you tell me your name?
Oh, Drew Danik.
Okay. And can you tell me what day of the week it is?
It is Wednesday.
Okay, perfect. And then can you tell me why you're here?
Just for a general checkup.
Routine physical.
Routine
and where
physical.
are we?
At the doctor.
Okay.
The hospital. At the house.
At the hospital. Okay, great. Thank you for answering those questions. Okay, so now I'm going to move into your vital signs.
Okay.
I'm going to go ahead and start with your blood pressure and then we'll go from there. Does that sound good for you?
Sounds good to me.
Okay, so you have on a bit of a thicker jacket, so if you don't mind taking that off.
Buttons.
Great. All right, so I'm gonna go ahead and measure this cuff on your arm, make sure it's the right size for you. Should be about, okay, great. So this is gonna work nicely for you.
All right.
So I'm gonna go ahead and place this on your arm. Excuse me. Okay, first thing I'm gonna do is locate your brachioradialis. There we go. Okay, great. So what I'm gonna do is I'm gonna go ahead and blow this up until I can't feel this pulse anymore.
Okay.
Okay, great. Your brachial occlusion pressure was about 120. So I'm going to go ahead and let this cuff completely depress so all of your blood flow goes back to normal for a few minutes. And while I'm doing that, I'm going to go ahead and take your pulse.
Okay.
Okay, great. Your pulse was 65. That's within normal range.
Okay.
Everything's good there. So I'm going to go ahead and come back to this. I'm going to blow the cuff up to about 30 psi higher than I found, so about 150, and then we will get your blood pressure.
Sounds good to me.
Okay. Okay, so I got 122/79. That's slightly high. We'd like to categorize that as pre-hypertension.
Okay. So what can I do to lower that?
So you do have a family history of hypertension, so that's always a concern. But usually for pre-hypertension, we like to control that with lifestyle changes. So maybe adding some more cardio into your diet, into your exercise routine, and cutting out salty foods from your diet. So we can definitely talk about that a little bit more.
Okay.
But I'm going to continue going. So I'm going to take your temperature, so that would be 36.5 degrees Celsius, which is within normal range. And I got your pulse. Great. Okay. Are you having any pain today?
Nope.
Okay. If I were to give you a scale of 0 to 10, with 0 being no pain and 10 being the worst pain ever, how would you rate that?
0.
0, good. Okay, all right. And your respirations were 13, which is within normal rate. Okay, and what's your height, Drew?
5'10".
5'10", okay. And how about your weight?
170 pounds.
170 pounds, okay. Very good. So that's the end of the vitals. So now that we've kind of completed all of that, I'm going to go ahead and start your actual physical exam.
Okay.
So we're going to do this in a head to toe fashion as well. So I'm going to kind of start with your head and look at kind of like the cranial nerves and all of that stuff. So the first thing I'm going to do is I'm going to go ahead and feel for any lymph nodes that are swollen. So just do that. Okay, I didn't feel any lymph nodes. Next, I'm going to look for your trachea just to make sure it's midline. You can like tilt up kind of. Perfect. Okay, it looks midline. Everything looks good there. I'm going to take a brief look at your conjunctiva, so open your eyes for me. Okay, great. Looks pink. Everything looks healthy. All right, the next test we're going to do, I'm going to have you cover one of your eyes with one of your hands. Perfect. Okay, so I am going to raise my hand up into your vision. This is just to test kind of your peripheral vision. So when you see my hand, let me know.
I see it.
Okay?
I see it.
Okay.
I see it.
Great. All right, you keep like that.
I see it.
Okay?
I see it. See it.
Okay, great. Now switch hands. Okay, perfect.
I see it. Yep. Yep.
Okay, you stay like that?
Staying. Yep. Got it. Yep.
Okay, very good. Thank you for doing that. All right, so the next thing I'm going to do is I'm going to test for pearl. It's basically looking at your eyes and your pupils and making sure they're reacting to light correctly.
Okay.
All right, so what I'm going to dim the lights.
Okay.
So I just dim the lights.
Okay.
So this is my pen light.
Okay.
I'm going to go ahead and shine this into your eye. All you have to do is just look at the light, okay?
Okay.
All right, so boom,
Whoa.
your pupil contracted, so that's good. I'm going to do it in this eye. Okay, great. Just look straight ahead at me. All right, so I'm making sure this one constricts, and then I'm making sure this one constricts. So that's great. Everything looks good there. Next, I'm going to kind of look at the way that your eye muscles are working. So if you just look at the end of my pen, follow it with your eyes, but keep your head still, okay?
Yep.
Okay, very good. Are you okay?
I haven't had to do that in a while.
When was the last time you had to do that?
Concussions.
Oh, well, you passed this time, so.
That's good to hear.
Okay. All right, so next I'm going to test your muscles of mastication, or muscles that help you chew.
Okay.
So I'm going to put my hands here. I'm going to ask you to open your jaw and close. Great. I didn't feel any clicking or anything like that, so that's good. I'm going to have you close your eyes, and what I'm going to do is I'm going to touch your face with a cotton ball, and you let me know when you feel it.
Feel it. Yep. 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 Yep.
Okay, great. Okay, you can open your eyes. So the next thing I'm going to do is, why are you looking at me like that? Okay, next thing I'm going to do is assess your facial muscles.
Okay.
So leave your mask on, but I'm going to act as if you don't have a mask on.
Okay.
So I'd like you to smile for me. Good. Frown. Good. And then puff out your cheeks and hold it. Good. All right, you can breathe. Very good. So your muscles look great. I don't see any, changes there. The next thing I'm going to do would be checking out your uvula, the little thing that hangs in the back of your throat. Make sure it's midline. I'm not going to do the exam on you now because we're going to keep our masks on. But I will have you say, ah. Great. And then swallow. Did you have any problems swallowing, or was it hard for you at all?
Nope. Not
hard at all. Okay, great. The next thing I would do is an oral exam.
Okay.
I am not going to do the oral exam, but if I were, I would just look to make sure everything looks healthy in there, everything's pink, everything's good. So good job, it looks great. And then I would also look for your tongue to make sure it's midline and pink. And then I would have you say light, tight, dynamite.
Light, tight, dynamite.
Great. Very good. All right, so that's great. The next thing I'm going to have you do is cover one of your ears. I'm going to whisper into this ear, and you just tell me what I say.
Okay.
Pig, apple, orange.
Pig, apple, orange.
Great. And then cover your other ear. Horse, donkey,
Horse, donkey, broccoli.
Okay, great.
Tongue twisters.
Tongue twisters. Okay, great. So that was good. It looks like your hearing's fine. Next, I'm going to test your the strength of your muscles up here. So push against my hands. Great. And then turn against my hand. Great. Very good. Okay. So that is the end of the head exam. So next, I'm going to move on to your posterior chest, which is your back. I'm going to start with, we call it tactile fremitus. I'm just going to place my hands on your back. And when you feel me move my hands down, just say 99. Go ahead.
99, 99, 99, 99, 99.
Okay, great. The next thing I'm going to do is percussion. You don't have to do anything. You can just sit there. Okay, great. That all looked normal. If you don't mind leaning a little bit forward or scooching up a little bit, sorry, this chair isn't ideal. I'm just going to place my hand kind of over your kidney. You tell me if this is tender or it hurts at all.
Mm-mm. No.
No tenderness? Great. Okay, the last thing I'm going to do is I'm going to listen to your breath sounds. So every time you feel my stethoscope touch your back like this, just take a deep breath in and out through your nose or your mouth.
Okay.
Okay, 1 second. All right, go ahead. Okay, great. You can go ahead and sit back. Very good. So now I'm going to go ahead and move up to your chest. So the first thing I'm going to do is just inspect it and make sure I don't see any like heaves or pulses or unusual masses. Everything looks great. I don't see any of that. The next thing I'm going to do is move up to your carotid artery. So I'm going to go ahead and palpate this side first. Okay, great. Pulse feels strong. I'm going to palpate over here. Okay, great. Next thing I'm going to do is I'm going to actually listen with the bell of my stethoscope to your carotid artery, just to make sure I don't hear any bruits, which is like turbulent blood flow.
Good.
So when you, when I do this, I'm going to ask you to take a deep breath in and then release and then hold it. So go ahead and do that for me. Okay, great. You can release, breathe. Okay, now do it again. Okay, great. Go ahead and release. Okay, The next thing I'm going to do is go ahead and listen to your lung sounds on this side of your chest. So same thing, when I touch you, just go ahead and take a deep breath in and out through your mouth.
Okay.
1 second. Okay. All right. Okay, great. Perfect. I didn't hear any unusual sounds. The next thing I'm going to do is go ahead and start listening to your heart. I'm going to listen for a few seconds at each spot, and just because I'm listening for a long time doesn't mean anything's wrong. So I'm going to do it with both sides of my stethoscope, so this will take just a few seconds. So bear with me.
Okay.
Okay, great. Our heart sounds sound great. I don't hear any murmurs or anything like that. Okay, so the last thing I'm going to do on your chest is I'm going to go ahead and feel your PMI, which is about here. I'm just going to feel this for about 1 minute and make sure pulse is steady here. Okay, great. Everything looks good there. So next thing I'm going to do is I'm going to move on to your abdomen. Unfortunately, the situations aren't great, so we're going to have to have you lay on the floor for a few minutes if you don't mind. Let's just pretend it's a bed. No. Oh no. Wait, there we go. Okay, great. Okay, so the first thing I'm going to do is I'm going to go ahead and inspect, make sure I don't see anything unusual, and I don't, so that's good. The next thing I'm going to do is go ahead and listen to bowel sounds. Sorry if my stethoscope is cold. Okay, great. I hear bowel sounds in all 4 quadrants. Next thing I'm going to do is listen to your vascular sounds. I'm going to start with the aorta, and then I'm going to listen to your renal and iliac arteries. Okay, great. I didn't hear any bruise or any turbulent blood flow there. So the next thing I'm going to do is go ahead and percuss in all 4 quadrants. And this is just to check, make sure there's tympany. Okay, great. Everything looks normal there. And then the last thing I'm going to do is just lightly palpate in all 4 quadrants. Tell me if you feel any tenderness or pain.
No.
Okay, great. I didn't feel any masses, so I'm going to go ahead and help you sit up.
All right.
Okay.
That's all right.
Cut off. All right, great. So that's the end of the abdominal assessment. Now we're going to go ahead and move to your upper extremities. Okay, so the first thing I'm going to go ahead and test for is just the strength of each of the 3 joints in your arms. So I'm going to go ahead and put your hands out like this, not press down, just with your wrist.
Oh, just my wrist.
Yeah. Okay, press up. Great. All right, so I'm going to go ahead, press with your elbow. Great. And then press down. Okay, great. Now kind of like chicken wing out, press down, press up, press down, press up. Great. Now for range of motion, just do this with your wrists. Any problems there? Backwards. Great. In and out. Okay, great. And then you can do chicken wing. Up, down. Okay, great. Any issues with that or any pain?
No.
Okay, great. So range of motion looks good. The next thing I'm going to do is go ahead and palpate radial pulses on each arm. Okay, great. Nice and strong. Okay, great. All right. Next thing I'm going to do is assess capillary refill. So I'm going to go ahead and pinch in the side of one of your nails, and the color should return less than 2 seconds, which it does. Okay, great. Very good. The next thing I'm going to do is I'm going to have you close your eyes. I'm going to touch your arm just like this, and you let me know when you can feel it, okay?
Okay. Yep. Yep. Yep.
Actually, I'm going to do one arm at a time. Is that okay with you?
That's fine.
All right, go close your eyes.
Yep. 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 Yep.
Okay, great. Everything's cool there. The next thing I'm going to do is I'm going to have you pat your hands against your legs, but alternating with your palms and the top of your hands. This, and I want you to get faster. Okay, great. You're good at that. All right, very good. The next thing I'm going to do is have you close your eyes again. I'm going to take one of your hands, and I'm going to either raise or lower your finger, and you tell me which I'm doing, okay?
Okay. Raise. Lower. Lower. Raise.
Okay, great.
Raise. Raise. Lower. Raise.
Okay, great. Very good. You can open your eyes. Okay, great. So the next thing I'm going to do is test your reflexes of your arms. Okay, so no. Okay, so what I'm going to have you do first is I'm going to have you just completely let your arm go dead in my hand, okay? So I'm going to have you let this go. Drop it. Perfect. Okay. Completely dead. Okay, great. Do the other arm. Okay, let it drop completely. Drop. Great. Okay, so now I'm going to do the bicep. So go ahead and let your arm completely relax. Okay. Great.
Tingles.
All right, completely dead. Okay, great. Okay, very good. Everything looks good there. Reflexes are normal. Is your hand okay?
Yeah, it just feels funny.
Okay. All right, so that is the end of the upper extremity exam. I'm now going to move on to your legs.
Okay.
So I do need to get the reflexes of your legs. Can we raise this chair up a little?
This is as much as we can do.
Okay. I don't know if this is going to work. Okay, good enough. This is what we would do. So first thing, to test your reflexes, I'm going to just completely let your leg hang, go dead. All right, so I'm going to support here. Okay, great. All right. Okay, great. Everything looks good there. I'm going to test your Achilles reflex now. So again, let it hang. I'm going to lift your toe up like this. Great. Let your leg hang completely. Thank you. Great. Reflexes look normal. I'm also going to test, you can remove these if that's uncomfortable. I'm going to test the strength of your lower extremities as well. So let's do your ankles first. So press down, okay, press up, great. All right, press against me, press forward, press against me, great. And then push in, push out, great. Muscle strength looks good. Next thing I'm going to do is just kind of briefly assess for your hair distribution. It does look even and normal, so that's great. I'm going to test, just feel for temperature. Okay, your temperature is warm and it's even, and there's no places where it's hotter than the rest, so that's great. And then the last thing I'm going to do is test for edema, so that's swelling of your lower extremities or your feet and ankles. And I'll just press in for a few seconds. Okay, great. I don't see any signs of a swelling in your feet or ankles here. Okay, so the next thing I'm going to do is I'm going to actually take these slippers off. Okay, so I'm going to actually palpate your pulses down here just for a few seconds. Okay. Okay, great. Those pulses feel normal. So I'm going to have you go ahead and stand up now. Okay, so the first thing I'm going to have you do is I'm going to assess your gait. So you're going to heel toe walk towards me and then away from me. So go ahead. Okay, great. Now turn around. Okay, and back. Okay, very good. Next thing I'm going to do is have you come on the screen, and I'm going to have you stand with both feet on the ground, close your eyes, and just stand there for a couple seconds. And if you get dizzy, please open your eyes. Okay, great. So now I'm going to have you close your eyes again, but lift up one of your legs.
Going down.
Okay, great. Put your foot down and do it again with the other foot.
Eyes closed, right?
Eyes closed, please. A few more seconds. Okay, great. Very good. So I'll have you go ahead and sit back down just for the end of the exam. So meanwhile, through the whole exam, I was looking at your skin. I did notice your scar from your appendectomy in 2002. I didn't notice any other scars or any unusual spots on you elsewhere. So that does conclude the end of the exam.
Okay.
I did see that you had some pre-hypertension and that you wanted to get some more education on that. So I will make sure that you have a educational printout as well of what we talked about, kind of changing, adding more cardio to your exercise routine, kind of changing your diet to cut out some salt and things like that.
Okay.
Do you have any other questions for me?
Nope.
No questions at all?
No questions at all.
Okay, great. Well, it was very nice to meet you, Drew.
Good to meet you too.
I will go ahead and let you get dressed, and thank you for participating in my video.
Thanks for having me.
Okay.